This is part 7 on the series of chest pain I said I'll be talking about. So today I'll be talking about costochondritis. So for those who have not watched part 1 to part 6, please do wait to watch those videos. And for those meeting me for the first time, I am an emergency medicine physician. I see patients with acute and life-threatening illnesses. So back to costochondritis. What is costochondritis? Costochondritis, the best way I can describe it is an inflammation of the joint between the rib and the costal cartilages, and in some cases between the costal cartilages and the sternum, which many people call the breastbone. This is the joint between the rib and the costal cartilages. So when there's an inflammation here, like these examples you are seeing here, this is a costochondritis. Or when there's an inflammation in this part just between the costal cartilages and the sternum itself. Now, when you have costochondritis, what are the symptoms that you present with? Typically, you present with a chest pain. And this chest pain, you will describe it as a sharp chest pain that is worse when you breathe in, when you cough, or you change posture that moves your chest wall, basically. I know you'll be wondering, how is this different from the previous chest pain I've talked about? Remember, I said in heart attack is described as a compression type of chest pain, as if someone is sitting on your chest, and this chest pain in many cases radiates to the arm, to the shoulder, or to the neck. While in pulmonary embolism, remember I said the pain is sharp. However, it is worse when you take a deep breath. But when you move forward or you lie down, it does not affect the intensity or the severity of the pain. And even in pericarditis, I said when you sit up and move forward, the pain becomes better. For further details, please watch those previous videos to have an understanding. Okay, now I know you are wondering, what is the cause of costochondritis? The causes are numerous, but typically what is common, what I've seen among patients, is that one, it is caused when there's an infection. Now, that infection can also affect that joint that will not cause inflammation. The other common presentation that I've seen among my patients are those who are engaged in intense exercises, those carrying heavy weight in the gym. So with that weight that you are carrying, it can cause a pull on the chest, so that the pectoralis muscle on the chest can pull, and this will result to costochondritis. However, the interesting thing about costochondritis is that it is not a life-threatening condition. And the type of pain I've described and the symptoms I've described, in some cases, it might not present exactly that way. Now, what is important? When I see patients with this kind of chest pain, my interest is to rule out life-threatening causes of chest pain. So what I do is that I try to rule out heart attack, pulmonary embolism, and the other causes of the other life-threatening causes of chest pain. Now, once I have done this, I am very satisfied and I'm happy to discharge this patient home. And when I'm discharging this patient home, I will discharge this patient on anti-inflammatory drugs. Remember, I said that this is an inflammation of that joint. So anti-inflammatory will help to bring down the inflammation, thereby improving the chest pain. In certain cases, I can also prescribe steroid, which will help with this inflammation. Now, note that if the cause of this costochondritis is an infection, I will add antibiotics to the anti-inflammatory given to this patient. And for patients who have recurrent or chronic costochondritis, a physiotherapy plays a major role, where the physiotherapist will give you a targeted exercise regimen that will help to improve your pain. Now, when you have these kind of symptoms, please see a doctor to rule out life-threatening conditions. I know you have learned something today. Please like, share, and comment, and I will see you in part 8.